Hello guys, welcome to my channel SwathiPharmaJnan. Today's topic is aminoglycosides. They are part of antibiotics. We'll see the definition of aminoglycosides. Aminoglycosides are a group of natural and semi-synthetic antibiotics having polybasic amino groups linked glycosidically with two or more amino sugars. They are a group of natural or semi-synthetic antibiotics. They have polybasic amino groups. What is amino group? Amino group is NH2 group that is linked with glycosidically with two or more amino sugars. Again, they are linked with amino sugars with glycosidic linkage. These aminoglycosides are used to treat various bacterial infections which are caused by gram-negative bacteria. Aminoglycosides can be combined with penicillins or cephalosporins to show prolonged attack on gram-negative bacterial. Aminoglycosides will be combined with the penicillins or cephalosporins to show prolonged effect towards gram-negative bacterial infections. This shows antibiotic action by inhibiting the bacterial protein synthesis. The antibiotic will inhibit that bacterial protein synthesis. The drug will break down in the stomach without showing antibiotic activity through oral route. This drug will not show any antibiotic activity when it is given in oral route. It will just break down in the stomach, but it will not show any antibiotic effect. But it will show better activity when it is administered through parenteral route. Examples of various aminoglycosides are streptomycin, amikacin, neomycin, kanamycin, gentamicin, and nethylmycin. The above drugs are various aminoglycosides which are used to treat gram-negative bacterial infections. The first drug under aminoglycosides is streptomycin. The structure of streptomycin is little complex to remember. We'll remember this streptomycin structure in three parts as streptodin, that is inositol with two guanido groups. Next part is streptose, that is methyl pentose. Next is streptoscamin, that is N-methyl L-glucosamine. This is the complete structure of complete structure of streptomycin. Now we will see the first part, that is streptoscamin, which is N-methyl L-glucosamine. So we all know the glucose structure, that is which contain oxygen group here. CH3 CH2OH, OH CH3 CH3OH, and here there is a methyl amino group is present. So that's why it is called as N-methyl group. So methyl amino group is present here, CH3 group is attached, that is streptoscamin. There is a pentose sugar is present. Pento indicates 5-membered ring containing one oxygen. So here aldehyde group, hydroxy group is present. Here two methyl groups are present. Next to this, at second position, there is a cyclohexane group is present. To this cyclohexane group, various linkages or various substituents are attached. At first position, there is a oxys linkage which is connected to pentose streptodin inositol with two guanido groups. Streptodin contains, that is a cyclohexane ring. To this cyclohexane ring, there is a various substituents which are attached at 6th position. At 1 position, you can see the guanidono group. At two positions, there are two guanidono groups are present. What is guanidono group? 3 amino groups are attached to single carbon, that is called guanidino group. Coming to uses of streptomycin. Streptomycin is a first-line drug which is used in the treatment of tuberculosis, that is TB, and it is also used to treat plague and brucellosis, the disease caused by unpasteurized milk or off-cooked meat. In combination with, for the treatment of plague and brucellosis, streptomycin is combined with a tetracycline for the treatment to treat enterococcal and streptococcal infections. Next drug is neomycin. Neomycin also contains 5-membered group, that is pentose, and they are glycosidically linked with 6-membered hexose sugars. Pentose sugar and hexose sugars are interlinked, and the various substituents amino groups or hydroxy groups or methyl groups are attached to the various positions. That is structure of neomycin. If we'll practice Then we can write the structure of neomycin easily. To treat a variety of skin and mucous membrane infections, to treat gram-negative bacilli infections and gram-positive cocci infections. Next structure is cannamycin. Cannamycin is also one of the aminoglycoside. It contains all the hexose sugars which are interlinked with glycosidic linkage. Various substituents are attached at different positions. Cannamycin is a narrow spectrum antibiotic. Narrow spectrum antibiotic is nothing but antibiotic which can be used for the treatment of a single species is called narrow spectrum antibiotic. To treat serious bacterial infections in body used in plants transgenic resistance. These are the various aminoglycosides. We'll see the mechanism of action of aminoglycosides. Aminoglycosides inhibits protein synthesis by binding to the 30S ribosomal subunits. During the protein synthesis, ribosomes also plays an important role. So this aminoglycosides will bind to the 30S ribosomal subunits to inhibit the protein synthesis. 30S ribosomal subunits interfere with the initiation complex. Aminoglycoside 30S ribosomal complex induce misreading of genetic code on mRNA, messenger RNA, misreading mutation of the genetic code and the synthesis of nonsense proteins occurs. Nonsense proteins are not normal proteins. 30S ribosomal subunits, they will interfere with the initiation complex, elongation complex and termination complex are the three parts which will take place during the synthesis of protein. So during the initiation of the protein synthesis, the 30S ribosomal subunits will interfere. Aminoglycosides and 30S ribosomal complex induce misreading of the genetic code on messenger RNA. Misreading mutation of the genetic code. This misreading mutation of the genetic code leads to synthesis of nonsense proteins which are not useful for the protein synthesis for building of the bacterial cell. Nonsense proteins are not normal proteins. So nonsense proteins cannot take a part in bacterial cellular activities. Nonsense proteins will disturb the permeability of bacterial cell into the host cell. When the nonsense proteins takes part in the bacterial cellular activities, they will disturb the permeability of bacterial cell, the entrance of the bacterial cell into the host cell. Finally, the growth and development of the bacterial cell will get affected and which will lead to bacterial cell death. This is the structure of mitochondria where the protein synthesis takes place. Antibiotics attached with the ribosomes, 30S ribosomal subunits, the mutations and the modifications takes place. Along with the antibiotic under the 30S ribosomal subunit, they will interfere with the messenger RNA. They will interfere with the initiation complex of messenger RNA. So that will lead to the synthesis of nonsense proteins. So when the nonsense proteins occurs, the cell membrane modification or reduced uptake of the proteins takes place. We'll see the side effects and toxicity of aminoglycosides. After long-term use of the aminoglycosides, the various side effects and toxicity reactions can be observed in the patients. The various side effects are nephrotoxicity, toxicity effects in the nephrons, ototoxicity, toxicity effects in the ear, headache, neuromuscular blockade, dizziness, vertigo, fever and skin rashes can be observed in the patient who will take aminoglycosides. This completes aminoglycosides topic under antibiotics. Thank you.